So as many of you know, on October 14th, I stood on the State House steps and said that I would not leave until the governor fully reinstated the GA motel program that housed our neighbors experiencing homelessness. And I had no idea at that point that I would be there for 27 nights and 28 days. I was vastly unaware, despite my empathy, of the suffering that took place when one is sleeping in the cold on hard ground. I didn't know how hard it would be or how quickly I would begin to feel the effects of sleeping rough while we were there. And right up until the last day, there were so many people that thought that we could not win. And it was not easy, but we won. What I know is that this housing crisis did not start with COVID. It has been building for a long time. Our neighbors and community members have nowhere to go. From folks experiencing homelessness to upper middle income families, there is no housing in this state. We can't just put together a plan that looks good on paper. It has to meaningfully address and assess emergency housing, transitional housing, and permanent housing, from rental regulations and protections to home ownership, from land use to transportation. And the plan must center our most marginalized, including rural communities who are last in line right now to find a path to permanent housing. S226, which was signed into law, we had asked for while we were on the steps. Many of the incredible measures that would have been in there and 210 had to be taken out in order for it to be signed, and that was critical because it needed to move forward. But we want to be able to do the things, our legislators want to be able to do the things that help low and moderate income families in a very strong and meaningful way. I watched it clearly throughout this legislative session. There has to be a long-term plan that follows data, an interim plan that supports people sheltered until there's enough housing to meet need, and a deep analysis and reconfiguring of our support systems to address the enormous barriers to accessing those systems and housing. We know that housing is directly linked to mental and physical health. That is very often the first step to recovery for people with substance use disorder. We know that there's a huge number of pregnant women and people with children experiencing homelessness and housing insecurity. In fact, the hotline that I run, that was the #1 phone call that we got throughout the winter, was from folks who were falling through the cracks, who were pregnant or had children. We know that when people suffer from domestic violence, they become insecure, housing insecure, and we know that the LGBTQIA community and Black and Brown communities are particularly vulnerable to homelessness. But we're treating it like a moral failure and not our obligation to fix. And by we, I mean the administration. It is not enough to choose an arbitrary dollar amount. We have to have a plan that meets that need and addresses the broken system. Every time the legislature tries to address it, there's a veto threat on the table, and the governor should not be using his veto pen to govern. He just shouldn't. And this follows through with, as many of you know, on March 8th of 2018, my nephew, Brenda Siegel, whose upbringing I was a big part of, died of an overdose. And he was the son of my brother, who died just over 20 years before him, also while using heroin. They both suffered from bipolar disorder and severe trauma. And with 20 years between them, the supports were still not in place to make it possible for them to survive. Since then, I've traveled around the state and country to work on drug policy. For 3 years, I worked with elected leaders from all three parties to pass a science and data-driven policy to decriminalize, to remove criminal penalties from buprenorphine, the life-saving medication for people with opioid use disorder. The governor and his administration resisted this policy despite the overwhelming evidence that it was a safe and effective policy. The bill passed with huge amounts of tripartisan support, which is why it was signed. We could not do anything but make it become law. That happened alongside families like my own who have buried their loved ones and people in active use and recovery. I didn't do it alone. It was an uphill battle. Many times, people thought we could not win, but we won. What I know is that we have to focus on harm reduction first, treatment and recovery on demand, including medically assisted treatment on demand, dual diagnosis support, and criminal justice reform. This year, a bill that followed that plan was introduced for the first time in the Senate. It didn't move this year, but we know it will be reintroduced in the next cycle. And I want to note that in 2020, we ranked #1 for increase in overdoses in the entire country by a lot. And in 2021, we were in the top tier for the same and had the highest overdose deaths that we had ever had in our state. When doing this work, I often feel like I'm on a battlefield and people are dying all around me. I often feel like I'm spinning my wheels, but we have an administration digging their heels on an issue that has real solutions. This year, the legislature did create an overdose crisis response bill, and it was a good bill. And the governor vetoed it because of a study on overdose prevention sites. There were 2 other bills that would have helped people with opioid use disorder, with substance use disorder, and the governor vetoed them because of studies, because he did not want to learn more. These deaths are preventable and they matter. And right here in Windham County, we often have the highest increase in deaths. This last year, it was actually Lamoille County. And we are struggling with our treatment access. The governor has complained time and time again when the legislature tries to put forward funding toward harm reduction at a time when deaths are at an all-time high. We have to discontinue the practice of walking off the battlefield. These are human beings. They are worthy of life. They are worthy of the money being put into harm reduction measures that support them. Kaya Siegel, Kalijah Lindvall, my good friend's brother, Roy Krause, and I can go on and on. We're all people here in Windham County who deserved to survive. And we have science, data, and lived experience solutions that work, and we need to use them. Similarly, we have to follow the science on climate change. We don't have time for half measures. Climate change is disproportionately impacting vulnerable Vermonters, and we need to use comprehensive solutions and invest beyond electric vehicles. And make sure our solutions are accessible among low-income Vermonters, or we won't make change at all. Serving on the State of Vermont's Public Transit Advisory Commission, which I do, I've had the front row seat of the possibilities we have had to expand public transit. And yet we aren't doing enough for our rural communities especially, but also we can bring microtransit to many communities across the state. And thankfully we are expanding that to some extent this year. This year we had the ability to make more change due to federal funding, and we have to ensure that that reaches rural communities, as I said. The climate crisis can't wait. We are responsible to leave an earth that our children can survive in, and to care for a Vermont that we all love so much. I want to add that our state employees and teachers for 6 years have lived with a constant threat of their livelihood, whether it be a threat to veto the budget or an attack on their pensions from the administration. This year it was both, and in 2018 it was as well. Phil Scott claims that defined contributions would be beneficial, but has in fact not even done an analysis to find out if that is true, when there has been plenty of data on what it does to offer an optional defined contribution. It ultimately weakens the overall pension system. One doesn't have to search too hard to find that information. It's a simple Google search. And it is simply not true that it's best for our state employees or our teachers or our state. In 2018, when the governor didn't want to spend one-time money to pay down our pension obligation, that was absurd. When we have one-time money and we have a bill we have to pay it. Any person in poverty knows that when you get one-time money, you use it to pay a bill that you otherwise could not. We have an opportunity now. We had an opportunity now, as we did in 2018, to pay down that debt. And thankfully to the legislature, a unanimous legislature, we used it. Throughout COVID, the constant attacks on our teachers and schools, the leaving behind of the most vulnerable, the pressure on our state employees, the threat of a budget veto that would harm them, the constant vetoes in short and long term. Our educators and our state employees are the heroes of today, and we owe them more. The thing is that COVID is a crisis that we all did face, but it was not the only crisis or the first one. There was already an overdose crisis. There was already a mental health crisis. There was already a climate crisis. There was already a housing crisis. And we need leadership on those issues. We need a governor that understands those systems, one who has done the work on the ground with the people as an advocate in the legislature and within the systems. These are not new issues, and we need a governor that's ready to lead on them. I see those leaders every day in our community around me. There are leaders all around us. They are not looking for a position or power. And I know that when we work alongside one another, there's nothing that we can't do. I'm here because I know we must rise up together, and that a tough fight for the people of this state, for the people of this county, is one worth having. This is going to be a tough fight. It is going to be an uphill battle, but it's not even close to the toughest one that I've had to face in my life. And I am still standing. I know that if we come together, we can win. I'm running for governor because I know that it's time for us to move forward in this state. And I need all of you to get on board now, because it is, if you jump in today, that's how we move forward in this state. Win or lose, we have to move these issues. We have to support our legislature. We have to make it possible for us to move forward on very important issues and very hard work that the legislators are doing every single day, our legislators here in Windham County. Thank you, and I'll take questions. So Mike Mroiki asked me about Act 173, but I just want to say that this bill was changed the way we funded special education to grants and based on the census numbers. And the problem with that, and that we're seeing right now, is that there's a geographic equity issue in access to special education in Vermont. So if it's a community that has more poverty, if it's a community that has more need for special education or more need for mental health services, their funding is based on the census, which means they aren't necessarily being reimbursed. And so they're seeing huge holes in their budget. So we have to do something to create equity in education. Now, we're a state that loves local control, of our schools. And I see that there's areas where that's really important, but there's also areas where there is an equity issue, and we have to address the equity issue, because equal access to education, even though we probably have a Supreme Court, actually because we probably have a Supreme Court that will erode equal access to education, we in Vermont have to ensure that no matter the needs of the child, we are able to get them the education that they need and not underfund the majority of students as a result. So that's something that we need to do. I hope that was the right answer. It took us a while to figure out what the bill was, or what the act was that we were looking at.
Could I follow up on that?
Sure.
So I think that one of the things that we're seeing in eroding our public education system is this non-separation of church and state. And I'm just curious where you would draw the line. If we had the ability to not fund any private education with public dollars, would you support that?
Yeah, I think that I've definitely moved all over the place on this issue in my lifetime, because my son went to independent schools because of his particular needs. But the reality is that we have to fund public education fully, and the way to do that, and probably the way to do it before also, is to ensure that we aren't any longer funding any private education, because it just, for the majority of the schools, there are some schools that have that do take the voucher amount, and so that means that low-income folks and moderate-income folks do have access to those schools, but the majority of the schools, there's a huge funding gap, and so low and moderate-income families don't actually have access to those schools anyways, even with the voucher. So I think that it creates an equity in education issue.
Thanks.
Brenda, we have one question here from Bill Coleman. He entered in the chat. Brenda, to what extent are you planning on advancing discussions about the thinly veiled racism of right-wing GOP fear-mongering about critical race theory? I live in northeastern Vermont, where such nonsense seems much more prevalent than it may be in Windham County. Perhaps this spills over from New Hampshire, paralleling the important rubbish from other states.
So I don't even think there's a thin veil anymore. I think it just is racism at this point. It is, we have to address, again, I know equity in schools, this is going to be a big conversation about schools, apparently. We have to address the equity issues, and what really is being talked about when people criticize critical race theory is they're talking about learning the real history of our state and having true education. And there is a threat to our learning something that isn't what we learned as children, to our children learning the truth. And to us having to grapple with the truth of who we have been in society and how we have left out many populations, Indigenous populations, Black and Brown populations. And so this is an unwillingness to be uncomfortable in our need to move forward from our mistakes and do better in society. So I don't, and you know what, it is more prevalent in the Northeast Kingdom and in other areas, but there are certainly folks here, and because it's less prevalent, I would say that often the Black and Brown community are really harmed, and the Indigenous community are really harmed by the reality of it, because the lack of prevalence means that we aren't paying as much attention when it happens. So I want to add that. One is, have you given thought to who would be in your cabinet? They make a huge difference. And I just want to say that I'm on the GA working group, and I spend a lot of time talking to the DCF commissioner. I spend a lot of time talking to the commissioner of health on overdose crisis policy and the people who work in those systems. And not only does it make a big difference for legislators, it makes a huge difference for the advocates, and it makes a huge difference for the state employees who's at the helm there. And one thing that I've given a lot of thought to is how we increase representation in our leadership to make sure that people have both the active experience necessary to take on those roles, because I don't necessarily think that someone, running, for example, pasta restaurants is relevant experience for the Agency of Human Services. I don't necessarily think that someone who runs a certain kind of business is relevant experience for certain agencies. And I also don't necessarily think that just being a doctor alone makes you the right choice for a commissioner of public health. I think that public health experience and probably some lived experience would be really helpful. So what I've given a lot of thought to is, I don't think, it's not that there's not a bench. There's incredible people that get passed over who would increase our diversity in our agencies, and I think would make a huge difference in terms of both listening and presenting information to legislature on all of these issues. And the other question is, I do not know the answer to. The other question is about if there's a possibility of redirecting the $4 million investment plan for Grafton Cheese property in Brattleboro to creating housing opportunities in Vermont. So I just want to say that we do a lot of dividing our businesses from our people. And in order for our businesses to thrive, our people have to survive. This is something that the governor has done really handily throughout the state. And the reality is that right now, our businesses, our Main Street businesses, especially the smaller businesses, are being asked, are having, because in order to get employees, they have to increase their wages. That's good for people. But the big businesses like Staples here in Brattleboro, all over the place, are not increasing their wages at the same rate. And so we should be supporting our main streets in increasing their wages and their access to other benefits, while also demanding that our big businesses both pay their fair share and that they increase their wages and employees. It doesn't have to be a divide between businesses and people, between main streets and people, because actually those are the same human beings trying to survive for the most part. And so we really have to figure out how we all come to the table and sit down together until we get the job done. And that's what's missing in the administration right now, is someone who's willing to sit at the table until the job is done.